As many as 85 million people died in World War II, and in ancient agricultural societies, human violence caused 15% of all deaths. Today, human violence accounts for around 1% of deaths. In 2012, only 120,000 people died in war, whereas 1.5 million died of diabetes. For the first time in human history, when most people consider the future, they don't assume war. As we look to this year, while there is still starvation, disease, war, and inequalities, it's drastically better than most of human history. But we must continue to be critical of our governments, challenge companies, and rethink the way human society is structured in order to continue progress. By acknowledging the successful human efforts in medical research, economic reform, peace initiatives, and governmental support to decrease starvation, disease, and violence, we can find hope for the future. Hope is a valuable notion to focus on as we look for a way to be content in a world that, at times, can seem so overwhelmingly bad. If you could use...
Okay, now we are going to talk about current medical information leading to future knowledge. So scientists believe that eventually they will be able to make designer babies, genetically modified human embryos, by gene editing, which is CRISPR technology, by finding a target DNA sequence and replacing it with a desired sequence. CRISPR technology, theoretically, makes it possible to modify the genome of any living thing on the planet. Precision health is a modern approach to understanding health. The accusation of one size fits all doesn't exactly work. Precision health helps connect, analyze, and collect for a clear picture of health. Unlike today's treatments, which are based on obvious symptoms, standard tests, and common drugs. This information can come from your fitness tracker, scientists, research, genetics, and even your health history. Your individual information can help doctors understand your health better and see what exactly makes you unique. So modern technology in medicine, this plays a role in being able to sustain health. Medical technology has areas such as biotechnology, information technology, and pharmaceuticals, the Department of Medical Services, and equipment are all contributions to improving the health for people all around the world. So smaller innovations and large innovations, the smaller ones like bandages and ankle braces, to larger ones like MRI scanning machines, artificial organs, and even robotic limbs have undoubtedly made an impact on medicine today. So modern technology in medicine again. Okay, so for some mobile device users, you can download the app to track your health. You can do that through FitnessPal. You can do that through your Fitbit app, which is what I use. It shows your calories. You can put your water intake on there. You can even put your weight. It will show your steps, your heart rate, and absolutely everything, miles that you've walked. It does absolutely everything you need. And the doctors actually do recommend it. These apps can update your doctor on your health as well. A lot of the times they're interconnected. I think that all depends on the app, but I'm pretty sure you can do that, and it's a good way to keep in touch, especially if you have any questions. So what does the future have in store for health and medicine industry? Okay, so before we're even born, we have treatment due to feature scanning. These things are hopefully going to improve even more. Future humans will be able to have a better start in life. As they grow up, internet will allow wearable gear technology for children. It will tell heart rate, size, and even body temperature, allowing data for when you're healthy to help you for your future sicknesses or if something is just not quite right. If the child or adult needs to go to the doctor, we will get a whole body scan, which is technically like a gigantic glass box that you walk into and it scans absolutely everything on your body. So after it has collected all the data that it needs from the scan, it will show your picture of health for the doctor to look at. So if medication is required, it's also possible that artificial intelligence, could produce such things. So artificial intelligence helps us create new information from old data. The computer sights through all of the chemical or medical data and uses that to develop new drug molecules. So future hospitals will have robots that help move and transport patients around the hospitals. So algorithms processed by computers to help diagnose patients, they can do that better than humans ever could, which if you think about it is crazy, but it's going to be very interesting if they actually can do that. So social media impact. So healthcare trends even go on social media. Nowadays, doctors can respond to patients online. 60% of patients actually. Channels such as, not normally Facebook, but I believe that is one of them that they could use. They have their actual medical site. They have the portals for you to sign into to look at all your medical history. That improves the quality of care. So little things can have a huge impact on health. Organizations are trying to reach out to patients by ensuring that they're taking the correct medicine, to make sure it's the right dosage, that they're eating healthy, exercising correctly. They do all these things to make sure that the patient is cared for. This way, it's a win-win situation. Okay, so for the activity guide, this is actually where I'm going to stop, and Madison Harrison is going to take over. So thank you very much for your time.